This is Adam Rosh from Roshcast, and I want to welcome you to another episode of The Reveal, where I will take you inside the mind of a test taker to deconstruct and connect the dots of a board-style question so you can become a better student, transform how you learn, and excel not only on high-stakes exams, but also in your general medical knowledge. So let's get started. We have a 52-year-old man with a history of diabetes and hypertension. He presents to the emergency department with palpitations and dyspnea that have been present intermittently over the past week. His vital signs include heart rate 135, blood pressure 136/87, respiratory rate 15, and oxygen saturation 97% of room air. His ECG is shown above. Which of the following is the most appropriate initial management? So this is a two-step question. First, we're going to identify the diagnosis. In the ECG above, looks like it is an irregular tachycardia with narrow QRS complexes. So this is atrial fibrillation with a hemodynamically stable patient. That is very important here. So we have a blood pressure of 136/87, a respiratory rate of 15, an oxygen saturation of 97%. And we do not have a patient really with any other concerning symptoms or present or signs of hemodynamic collapse right now. So we will consider him relatively stable at this time. He does have some palpitations and dyspnea, however, and he does have multiple cardiac risk factors with diabetes and hypertension. But let's look at the answer choices here and see what we come up with. So answer choice A, administer IV adenosine. So if the patient had a classic SVT, as in paroxysmal SVT or AV NRT or AVRT, we would choose adenosine. However, this is an irregular ECG rhythm, and therefore adenosine is not the best answer choice here. Let's go on to C. Sedate the patient and perform synchronized cardioversion with 100 joules. So this, anytime you have a patient in a tachydysrhythmia, you're going to consider synchronized cardioversion. And in this case, however, the patient's stable. You see a normal blood pressure, a respiratory rate that's okay, 15, oxygen sat of 97%. So while synchronized cardioversion is an option, it doesn't necessarily, in this case, need to be the initial management at this time. So I am going to X that out. Transport the patient to the cardiac catheterization suite. Answer choice D. Well, if this patient had signs of acute ischemia due to ST elevation, which we do not see in this ECG at this time, he may have some demand ischemia given the elevated heart rate and known coronary risk factors here. However, for this question, it is not the most appropriate initial management at this time. So let's X that out. And that leaves us with answer choice B, administer IV diltiazem. Diltiazem is a calcium channel blocker. It will act on the AV node. In this case, the goal here is rate control for this tachydysrhythmia. And let's choose answer choice B and see what we get. Sure enough, that is the correct answer. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.